Hello everyone, myself Dr. Babu, specialist cardiologist working in Aster, Kisses branch. Today I'll be speaking briefly about heart attack, the danger signs of heart attack. Heart attack is a major killer disease in the world. The general public should be aware about what is heart attack, the clinical manifestations, the complications, when to act and how fast to act. There are classical manifestations and non-classical manifestations of heart attack. What is heart attack? Heart attack is the obstruction to the blood supply to the heart, resulting in death of the myocardial tissue. Coming to classical symptoms of heart attack. The classical manifestations are chest pain, shortness of breath, palpitation, and syncope. Chest pain is one of the commonest manifestations of heart attack. They present with central chest pain, gripping type, tightening of the chest, or heaviness over the chest. May or may not be associated with radiation to the shoulder, radiation to the abdomen, or radiation to the back. The progressively increasing type of chest pain lasting for more than 20 minutes, more likely to be of cardiac origin. Shortness of breath is the second most common manifestations of heart attack. When chest pain is associated with shortness of breath, then it is invariably of cardiac origin. Such patient has to be taken to the hospital and treated immediately because it can lead to fatal complications. Palpitation is less common manifestations of heart attack. This occurs because of the rhythm disorder as a complication of myocardial infarction. The rhythm disorders like ventricular tachycardia and ventricular fibrillations can occur episodic or intermittent. When it is episodic or intermittent, they manifest with palpitations. If the rhythm disorder persists for more than 3 to 5 minutes, patient develops brain death. If it persists for more than 7 to 10 minutes, patient collapses and results in cardiac arrest and complete death. Syncope is less common manifestations of heart attack. Syncope occurs because of the pump failure, where the blood supply to the brain is reduced, patient collapses, and if it is for a brief period, the patient regains consciousness, or the patient might develop complete cardiac arrest and completely die. Non-classical manifestations of heart attack. These are the manifestations in the absence of chest pain, which can be a shoulder pain in the absence of chest pain. Left shoulder pain is the commonest presentation, whereas right shoulder pain can also manifest but is less common. So when do you suspect chest pain or a classical symptom or a non-classical symptom to be a heart attack? Age of the patient, more than 40 years of age, more likely to be of cardiac origin, but these days due to the lifestyle changes, lesser ages also manifest with heart attack. Presence of diabetes increases the likelihood of heart attack. Hypertension again increases the likelihood. Smokers again increases the likelihood of heart attack. Strong family history of coronary artery disease again increases the risk of heart attack. So what you should do when you suspect a heart attack? Patient has to be taken to the hospital immediately. ECG has to be taken. ECG is the first most common investigations to rule out myocardial infarction. But ECG is not 100%. 30% still can miss the chances of heart attack. It is exclusively the decision of the cardiologist whether to evaluate further or to stop the investigation at that point of time. Once the diagnosis of heart attack is made, the patient has to be treated immediately. There are two choices. One is thrombolytic agent, which is given IV. The other one is primary PCI. Thrombolytic agents are those medicines which can break the clot and increase the blood supply to the heart. But it is associated with risk of bleeding, 1 to 2%. The second most common choice is the primary PCI. It is the opening of the blood vessel with balloon and stenting. The critical period is door to needle and door to balloon. Door to needle is 60 minutes where the time that a patient arrives to the hospital to the opening of the vascular access. Door to balloon is 90 minutes, where the time the patient arrives to the hospital and the obstruction is opened with the balloon and stented. The golden period is 3 to 6 hours. Within this 3 to 6 hours, if the myocardial perfusion is achieved, the majority of the myocardium can be saved. The more the delay, the more the damage. Thank you.